Hello po,
Hello,
muli sa
everyone.
lahat.
Welcome to our LUMP webinars. LUMP, TCM, and Acupuncture Basics. Let's welcome, as our first presenter, Ma'am Mildred Digma, Certified Acupuncturist from Apayao. Good afternoon, Ma'am Mildred.
Hello po. So, ang ating pong topic ngayon na ang excess states. Interior relationship. So, tingnan po natin yung mga excess. Deep energy circulation sa lung channel. Yan po, balikan po natin yung ating lung channel. Nag-start sa ating chest. And then, bababa siya dun sa dulo ng ating thumb. The lung channel sa exterior part and an interior part. In the interior part, the channel flows to the large intestine and to the lungs. Partner organ niya yung large intestine. So yung large intestine channel naman ay nag-start sa dulo ng pintuturo. Ayun po, makikita natin. Then nag-end siya sa may ilong. Yun po sa gilid ng ating ilong, large intestine 20. The large intestine channels also has an exterior part and an interior part. Note that the interior channel goes through the lung to enter the large intestine. Kasi magka-partner organ po siya. Through this interior meridian, on which there are no points, energy flows between the lungs and large intestine, always from where there is an excess to where there is an deficiency. Both internal branch, meridian, are in the interior of the body. So pag yung meridian po nasa interior yun ng katawan, And therefore, in the same climate, because of this, the energy that flows from one to other meridian is of the same polarity. So yang flows into the large intestine yang. Lung yin flows into large intestine yin. Large intestine yang flows into lung yang, and so on. So, yun po yung interconnection niya. So, example po ng lung yin excess. Lung with its yin and yang. So, yun po yung normal level. If the lung yin excess increases and large intestine yin is normal, then through the exterior meridian, lung yin flows into the large intestine. So, ayun po yung yung drawing. Large intestine with its yin and yang. Yin excess in lung manifests is fullness and excessive mucus. So, pag yung lang po ang nag-yin excess, in large intestine, yin excess manifests as large watery stools. So, yun po yung mga nangyayari. Affected pareho sila dahil partner organ. To treat this imbalance in both the organ, so, sabi ng author, I use point lang 5. So, sedation point po with the sedation needle technique. When the sedation point of a meridian is sedated, reduce both yin and yang energies. Nagbabawas ka ng yin and yang energies sa organ by dispersing it to another organ. Dadali mo dun sa kabilang organ. But it is send out more of the house energy than the opposite energy, which means sedation of lung 5 disperses approximately 90% of yin and only about 10% of yang energy. This work well to balance the imbalance in questions. So yun po, dahil partner organ po si lung and large intestine, pag nag-sedate ka po dun sa isa, pupunta po dun sa kabila. Sedation of lung 5 send out more yin energy, thus mainly reducing lung yin. So, yun, nag-aalis ka ng yin pag sobra yung yin dun sa organ. Now, large intestine has more yin than the lungs. And since they are connected in the interior, it flows automatically into the lungs. Pag nag-sedate ka po dun sa large intestine, pupunta po yun sa lungs. Through the interior meridian, dahil may connection sila sa interior, thus bringing the large intestine yin down to the same level. So sedation needling technique are explained on page 430. Sedation points and how they work are explained on page 100. Dun po sa another ano natin. This is direct sedation of lung yin and indirect sedation of large intestine yin. If you wish to sedate the yin, either in yin organ or in its coupled organ, it would suffice to sedate only the yin organ. So, maapektuhan po siya, magkakaroon ng counter effect. An excess in lung yang with symptom of bronchitis or eczema. So, kung sobra po yung yang dun sa lung, so magsasedate ka, ang excess energy ay pupunta po sa large intestine. Nagkakaroon siya ng colic, painful stool, or colitis. So, dun po siya pupunta. So, sabi ng author, if I need to sedate lung yang, point lung 5 would be suitable. So, as it would sedate more of the yin, therefore, point lung 2, the sedation point of large intestine, should be used, as this would sedate much more the house energy of the large intestine, which is yang organ. So, when large intestine yang is dispersed, the large intestine would have less yang than the lungs. So, mababawasan po yung yang ng large intestine. As these two organs are connected through the interior meridian, yung excess yang po would flow automatically from the lungs to large intestine. So, pupunta dun sa partner organs niya, thus reducing lung yang as well. Mawawala dun sa lungs, pupunta siya sa large intestine. This is direct sedation of large intestine yang and indirect sedation of lung yang between coupled organ. So, pag natanggal mo na dun sa lung, pupunta sa, pwede ring mawala dun sa partner organ niya. So, pwede yun nga, maidudumi mo na, kaya mawawala na. Yung init sa baga, pupunta sa large intestine, then idudumi ng large intestine, yung mga init, then magno-normalize. Siya po yun yung explanation niyan. So, if the yang needs to be sedated, either the yin or the yang organ, it is the yang organ that should be sedated. So, yung yang organ, yung large intestine. So, it is not necessary that the yang of the yin organ is only sedated over the coupled yang organ. Halimbawa po, mataas yung yang ng lung, ibig sabihin nataas yung init ng lung, pwede mo po itong sedate directly with special needling techniques or bloodletting techniques. Pwede po yung di ba? Yung pinapadugo. Or by using other energy balancing laws. It is the way to achieve the result. To do this, we use the interior relationship between the coupled organ. Pag mag-tonification points, pag yin organ po sa lung 9, itonify mo rin yung yang organs. Itong large intestine 11. Partner organ niya eh. Then, heart 9, tonify mo. So, matutonify din yung kanyang yang organ, small intestine 3. Magtutonify ka ng yin organ, pericardium 9. Tonify din po ang triple warmer 3. Spleen 2, stomach 41 sa yang. Liver 8 sa yin. Gallbladder 43 sa yang. Kidney 7 sa yin. Urinary bladder sa yang. So, ibig sabihin po nun, pag nag-tonify ka dun sa isa, natutonify mo na rin yung partner organ niya. Kahit alin ang gagamitin nyo dyan. Pag nag-sedate, ganun din po nag-sedate ka sa lung 5, pwede rin pong masedate na yung organ niya. Kung ang ginamit mo lang 5, masisedate na rin yung large intestine. Pag large intestine 2, pwede na rin pong masedate yung lungs. So, ganun po yung explanation niyan. So, pwede po natin gamitin yung heart 7 sa yin, and sa yang is small intestine 8. Sa yin, liver 2. Sa yang is gallbladder 38. Kidney 1 sa yin. Sa yang is urinary bladder 65. Spleen 5. Yin organ. And yang organ, yung partner organ niya is stomach 45. Pericardium 7. Triple warmer 10. So, pareho po yun. Kahit alin po yung gagamitin nyo ay may effect dun sa kanyang partner organ. Pag nag-sedate kayo dun sa isa, pwede na rin pong ma-sedate yung kabila. Thank you po.
Thank you very much, Ma'am Mildred. Up next is miscellaneous pathogenic factors. Let's welcome Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita. Wala ulit. Okay, let's talk about miscellaneous pathogenic factors. These are all the pathogenic factors that are not climatic, exogenous, and not emotional or endogenous. There are many of them, and we shall only be mentioning a few here. Most common ones are excessive food, too little food, excessive alcohol, overwork, lack of exercise, excessive sex, and blocks on meridians. Excessive food. Food is not only about eating for hunger and energy. It is a pacifier or comforter for many needs of humankind. It is used as a substitute for love, companionship, sex, and helps against boredom, depression, and sadness. When one eats for any reasons other than hunger, one usually eats more than the body requires and at the wrong time. According to our inner organ clock, the stomach functions maximally from 7 a.m. to 9 a.m. and minimally at the opposite time of the clock, 7 p.m. to 9 p.m. Therefore, it is important to have a good breakfast for two reasons. The stomach can digest very well whatever we eat at this time, and what we eat at breakfast can be used for generating functional energy throughout the day. But most people tend to overeat in the evenings because they are tired and stressed from work, or this is the time of day they tend to relax. Having their main meal in the evenings is quite usual in many families. What is also common practice is that many people do not have a good breakfast or lunch, so that they come home in the evening ready to make up for this in the evening. By eating a large dinner and following this up with dessert and snacks all through the evening, the stomach and spleen are taxed during their minimum function time. Over a period, this reduces the functional chi of these organs. So stomach and spleen function reduces with overeating and eating at the wrong times. The function of the stomach is to move and contract when food enters it. This helps to empty its contents to the intestines and also to reduce its capacity by becoming smaller. When the stomach and spleen chi is deficient, these functions of tension and contraction are absent, so that the person does not get the feeling that the stomach is full and their appetite satisfied with the quantity of food they have consumed. Instead, the stomach stretches indefinitely, and the person can eat large quantities. Later, they feel very full and uncomfortable for a long time because the stomach will work very slowly to empty itself. They will be sleepy and lethargic as a deficient stomach and spleen pull the chi from all the other organs to help their function. Spleen chi deficiency is one of the earliest imbalances in aging. This is caused primarily by the dump-producing foods we eat, dairy products, fats, refined sweets, and carbohydrates, raw and cold food. Overeating makes this imbalance 10 times worse. This causes a vicious cycle of stagnating dampness all over the body, and this further consumes the spleen and stomach chi. The wise old saying, "we are what we eat," should be slightly modified to, "we are also when we eat." Treatment. The patient identifies with the symptoms and will change willingly. Though it is not possible to follow this new style every day, they should be able to follow it most days. A good cooked breakfast, warm lunch. This could be cooked the previous evening and warmed up or eaten at the workplace canteen, and as light a meal as possible in the evening. Points, bladder 20, alternating with bladder 21. Stomach 40, which is the luo point of the stomach. This will tonify the stomach yang and reduce yin. Spleen 9, it's water point, and it sedates the yin and dumps stagnation. Ren 12, moxa. Given before the main overeating time, this helps to increase stomach yang, to increase contraction and thirst. Pericardium 6, distal point. Treat depression, nervousness, or stress according to the patient's symptoms. Having started this therapy and change of eating style, the patient will feel the difference when they occasionally lapse into their former eating habits. Thank you very much for your attention. So that's how we manage problems like eating in excess. Thank you very much for listening. Let's now proceed to the third presentation. Shen. Let's welcome Ma'am Lynn Galarita of Quezon City. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. We're on our fourth part on the topic on Shen. Previously, we end with the note that all emotions affect the heart, explaining why a red-tipped tongue is commonly seen even in emotional problems related to other organs. Today, we'll start off our discussion on Shen disturbances and how will this manifest on the tip of the tongue. Generally speaking, the progression of severity of emotional stress according to the tip of the tongue is as follows. We'll start with a red tip with a normal body color. And then it will turn into a red body color with a redder tip. Later, the red body is still with red body color, but the redder tip will present with red points. After that, it's still red body color, but the tip will be redder and swollen. Later on, the tongue will still have a red body color, a redder tip, a swollen tip with red points. And then the tongue will have a red body color, redder tip with red points, and then it will present with heart crack. After that, a red body color, redder and swollen tip with red points, and a deeper heart crack. These are the pictures of the tongue and its tip as it progresses from a normal body color with a red tip, a red body with a red tip, a red body with a tip and red points, a red body with red swollen tip with red points, a red body, red tip with heart crack, a red body, red tip, a stomach heart crack with sticky and dry yellow coat inside it. Now let's discuss on the swelling of the tip. A swelling in the tip indicates emotional stress affecting the Shen. It usually appears in conjunction with a redness of the tip, like as shown in the pictures. And let's have a case study here. The tongue description is this is a 39-year-old female patient. The tongue description, reddish with a deep crack in the center, a peeled coating at the root, curled up slightly red edges, and a red tip. Her symptoms presents red, itchy, dry skin at neck and face, sensations of heat in the body, and depression. Western diagnosis of her condition is atopic eczema, allergic rhinitis, and allergic asthma. Background to the disease, she has weak constitution, repressed emotions, and unhappy marriage. In TCM diagnosis, There is slight heat in blood, stomach deficiency, kidney deficiency, liver qi constraint with heat in liver, and heat in the heart. As for her case history, Mrs. S suffered from atopic eczema since age 25. Whenever she encountered emotionally difficult situations, her skin immediately turned red and dry and became very itchy. Her skin was particularly red around the neck and face. For many years, she used large amount of cortisone creams to improve appearance of her skin. Her marriage proved to be a great strain on her as her husband became mentally ill. She was very anxious and fearful and unable to express her frustrations and anger. In general, she felt very unhappy and experienced times of deep depression. As a child, she experienced frequent asthmatic attacks and acute bouts of allergic rhinitis, but they rarely manifested in adulthood. Red's tongue showed a very deep crack in the center, tip was very red. Her pulse was very rapid, thin, and slightly wiry. Analysis of her condition. First, the energetic condition of this patient can be characterized by deep constraint of liver qi with development of heat. Curled up and slightly red tongue edges confirm this diagnosis. They appear when long-standing emotional problems cannot be resolved. Here, heat in blood is mainly responsible for condition of her skin. Over many years, blood and fluids in superficial layers of body were injured by heat, which manifested as dry, red skin. This woman was always sick as a child and had weak constitution. This, together with application of cortisone cream for over 20 years, were main factors underlying weakening of stomach and kidney yin. Rootless coating of tongue is important indication of their deficiency. Deep crack in the center indicates stomach yin deficiency. Kidney yin deficiency and internally generated heat disturb organs' harmonious communication with heart, manifested in anxiety and depressive states. Rapid and thin pulse denotes heat from deficiency due to lack of yin. Wiry quality suggests liver qi constraint. In summary, center of tongue should be moist and show a thin coating. In stomach yin deficiency, cracks or dryness will appear in this area. Improper diet as well as eating in a hurry, too late, or irregularly may be important factors in the development of this deficiency. That's all for today. Thank you for listening.
Thank you very much, Ma'am Lynn. We now go to the 5 elements. Let's welcome once again, Ma'am Mildred Digma. Good afternoon, Ma'am Mildred.
Good afternoon po muli sa ating lahat. Our topic is about disease of the fire elements. Continuation po ito. Tingnan po natin ang high blood pressure. So ang treatment po dyan, yung symptomatic points na gagamitin ay large intestine 10, liver 3, lung 9, or stomach 36, large intestine 11, then spleen 6 po descending technique. So spleen 6 descending technique should not be used in patient with arrhythmias, angina pectoris, or history of heart infarction. So bawal po dun sa may mga sakit na yon. So liver blood excess, ito po yung drawing natin excess blood and fluids. So constantly high blood pressure, fat, phlegmatic patient, depressive, thick glasses, water retention, and constipation. Yun po yung mga sign and symptom na makikita natin pag may liver blood excess. Pag liver yang, excessive tension. So tumataas po yung init, yung yang. So mayroon po siyang high blood pressure with stress. Yung pag may mga stress, tumataas. Tapos normal blood pressure at night and in the morning. So pag calm na yung panahon, malamig, normal ang blood pressure. Yung face po niya ay red at saka mayroon rin siyang red eyes. Pag pakinggan niyo ang kanyang speech ay very loud. Then easily tense in body. And pag kidney yung deficient and heart yang excess, disharmony between the water and the fire. Kanya pang nangyayari So, karaniwan po ito sa young men of athletic build. So, less konti na po yung buhok sa ulo kasi involved nga po yung kidney. Then, meron din po siyang back problems. Then, diastolic pressure is high, not systolic pressure. So, sa diastolic po, they could have malar plus and night sweats. So, kung tingnan nyo yung kanyang mukha na mapula tapos sa gabi na mamawis. So, yun po yung imbalance of kidney yin and yang and heart yang excess. So, sa liver, blood, and fluid po, ito yung mga points natin gagamitin. Spleen 9 at stomach 40. Stomach 25, triple warmer 6, and large intestine 4. So, dapat po hindi kakain ng masyadong maalat na pagkain. Then, yung urinary bladder 23 po, needle natin or cupping. So, sa gabi, light evening meal. Hindi na siya kakain ng marami. Then, pag excessive liver yang naman po, ito yung excessive tension. So, ang treatment natin ay gallbladder 38. Isedate po natin yan. Kasama ang or triple warmer 6, isisedate din po siya. Then, lung 7, liver 5, do 20, urinary bladder 6. So, kailangan po avoid ang stress at saka maaasim na pagkain. Kasi yung liver po yun Food ng liver is, yung lasa ay sour. Kung sobra na yung yang, pag kumain pa kayo ng maasim, mas tataas po yung yang. Then maraming stress, kakataas. So sa kidney yung deficiency and heart yang excess naman po, yun ang disharmony between the water and the fire. Ang ating pong gagamitin ay kidney 7 or kidney 10, then lung 7 and ren 3. Kailangan pong uminom ng tubig. At saka maligo po kailangan naliligo kasi maraming init yung heart. Then blue color po yung mga blue color. Spleen 6 ascending po yan. Yun po yung blue color na pwede natin. Yung sa mga food po, siyempre yung mga food para sa heart, huwag pong masyadong sobrahan yung pait kasi yun, excess yang na nga siya. Patient with excessive tension could also be blood deficient. So, maaari siyang magkakulang ng dugo. They would not be manifest a red face and loud aggressive voice. So, they are fail and easily stressed. Kasi nga, sobrang tension yung flow ng blood, hindi maganda. Then, are tired and irritable, have weak muscle with overuse pain and tendons, have tension in muscles and tendons with difficulty to extend joints. Kasi nga po yung blood and chi, di ba liver ang nagmamanage dun para sa smooth flow. Kung sobra yung tension, maraming stress, hindi po niya magagampanan yung gawain. Have fibromyalgia, type wandering pain in muscle and tendons, yung palipat-lipat pong kirot. They should be treated with, tusukan po natin ang REN 14, urinary bladder 15, urinary bladder 17, and gallbladder 39. And such blood tonification points in addition to the ones method. So yung mga Yun, urinary bladder 17 tonification na po yan eh. Tsaka any symptoms, patients tend to feel content after a few acupuncture sessions and reduce blood pressure. Reading however, sometimes Latin without many symptoms, patients tend to feel content after a few acupuncture sessions and reduce blood pressure readings. However, the treatment must be continued for at least a year. So matagalan na pong pababalik-balikin natin yung pasyente. Even if it is not only administered once a month. Yung pag mga matatagal na po yung kanilang hypertension, talagang pagtsatsagaan na po natin yan. So, thank you po for your attention.
Thank you very much, Ma'am Mildred. Let's now proceed to the fifth presentation, TCM causes of disease. Okay, this time we talk about these 6 pathogens or the climatic pathogenic factors. In summary, so for the wind season, spring, it is a yang pathogen, constant movement and rapid change, up and out direction, induces invasion of other pathogens. So, and then it also invades the yang portion of the body, the yang channels, the skin and superficial area. So symptoms, perspiration, acute onset joint pain, common cold, measles, urticaria. Then we talk about the cold pathogenic factor in winter. It is a yin pathogen, congeals and stagnates, contracts muscles, and closes the pores. The cold invades through the skin, the spleen, large intestine, and uterus, channels, and impairs yang. Symptoms, cold. For cold, we have pain, joint pain, and abdominal pain, diarrhea, arthritis, shivers, muscle pain, and spasm, no sweating. Summer heat. So summer only. It is a yang pathogen, results from fire, consumes qi and body fluids. Summer heat invades the body with dampness. So there will be high fever, red face, profuse sweating, fatigue, shortness of breath, nausea, vomiting. Dampness is between seasons. It is a yin pathogen, disturbs and blocks qi movement. It is sticky and stagnate, lingering, heavy, and turbid. Dampness damages the yang and obstructs the spleen. So symptoms of dampness, bloating, nausea, vomiting, diarrhea, edema, heavy headache, or limbs, swollen joints, arthritis, cloudy, thick urine, eczema, sticky tongue coating. Dryness at fall. It is a yin pathogen, impairs body fluids and blood. Dryness enters through the mouth and nose, impairs the lung. Symptoms, dry skin, dry cough, dry nose and throat, dry stools, constipation, dry nosebleeds. And finally, for the fire pathogenic factor in summer, it is a yang pathogen, may be seen in all seasons, consumes the qi and fluid upward and stirs up wind. The fire pathogenic factor burns the liver channel, damages the yin, speeds up blood flow. Symptoms, profuse sweating, high fever, thirst, mouth ulcers, red bloody eyes, coma, delirium, convulsion, and bleeding. Thank you very much for your attention. We now proceed to lung functions or the Zangfo organs. Let's welcome once again Ma'am Lynn Galarita.
Good afternoon ulit. So for today, we're going to discuss about the lungs. And let's start off with lung functions. In summary, functions of the lungs in TCM are as follows. Number 1, govern qi and respiration. Second, govern diffusion and down bearing. Third, opens at the nose. Fourth, control the body surface. Fifth, houses the corporeal soul. And last, emotions of the lung is sorrow. Let's talk about lungs, govern qi, and respiration. Lungs govern qi. This means that the lungs are responsible for breathing and production of true qi. The spleen produces food qi or good qi from the food that we ingest. And then the spleen sends the food qi to the lungs. So as shown in the diagram, from the food that we eat, enters the stomach, and together with the spleen, they produce the food qi. After that, the spleen sends the food qi to the lungs, and from the air that we breathe, the lungs produces the qigong qi. So after that, from the air that the lungs from the qigong qi with in combination with the gu qi, true qi is produced. And from the true qi, we'll have the yin qi and the wei qi. After the qigong qi and gu qi in combination with yuan qi, true qi is produced, which consists of the yin qi and the wei qi. In the lungs, gathering qi or zong qi and true qi produced oxygen of air, which can be viewed as cosmic energy. In the lungs, gathering qi and true qi, pure energy is assimilated while breathing in. Impure energy is expelled while breathing out. True qi is divided into nutritive qi and wei qi. Production of gathering qi and true qi in the lungs is influenced by the original qi or the yuan qi from the kidneys. So the lungs, the kidneys, and the spleen are involved in weakness of the gathering qi and true qi. On the second function of the lungs, lung govern diffusion and downbearing. Lungs nourishes skin and body hair and protect exterior against invading pathogens. Diffusion aspect. As one aspect of lung function is to govern qi. In diffusion, it's responsible for ensuring movement of qi and sending defensive weight qi outward to body surface. On body surface, defensive weight or the weight qi protects us from invasion of pathogenic factors. Among the pathogenic pathogens affecting the lungs is dryness. As dryness is the main pathogen affecting the lungs. If defensive or Wei Qi is weak, lungs can be attacked by all pathogenic factors, since lungs are most exterior organ and breathing connects lungs to the outside world. Strength of immune system and ability to prevent invasion of pathogenic factors is based on harmonious functions of all involved in qi production. That's the lungs, the spleen, and the kidneys. Kidneys are source of a strong immune system, nourished by qi of spleen and stomach, and distributed through the lungs. Lungs govern waterways, which is a combination of two functions of diffusion and downbearing. Diffusion, the fluids are distributed throughout the body and skin, where they leave the body in the form of sweat. In downbearing, wastewater is conveyed to kidneys and bladder to be discharged. Lungs sends qi and body fluids to kidneys. In turn, kidneys must be able to hold qi and body fluids. If lungs are not able to maintain this function, stagnation in lungs causing weakness in kidneys. If down-bearing function is impaired, edema, mostly in the upper body, can develop. That's all for now. Thank you for listening.
Thank you so much, Ma'am Lynn. Let's now proceed to Meridian Theory. And let's call once again Ma'am Mildred Digma. Ma'am Mildred, good afternoon po.
Yes, Doc. Good afternoon po muli. So, Meridian Theory, 24 na po tayo. Small intestine channels of hand Tai-yang. Tai-yang or small intestine channels. Psychological significance of channel changes. Observation of areas related to Tai-yang, small intestine. Redness in the outer canthus of the eyes is associated with wind, heat of affecting the small intestine channels. Styes or other due to toxic heat in the small intestine channels. So yung mga colitis sa Tagalog, ano. Dahil po yun sa toxic heat ng small intestine. Then tenderness and redness around the area in front of the ears is also regarded as excess heat in the small intestine channels. Papules inside the ear may indicate damp heat in the channel. So silipin po natin yung mga tenga natin kung may mga ganun. However, changes around the ear are also often related to the gallbladder channel and therefore should be considered in the context of other signs and symptoms. Kasi partner organ siya ng liver, di ba? Kasi siya yung responsible sa ear. Pulse palpitation of areas related to Tai-yang, small intestine. There are no particular pulses that can be palpated along the path of the small intestine channels. So palpating the channel, freezing the points, and feeling the body surface. The whole lower aspect of the small intestine channel often shows a variety of changes in the presence of musculoskeletal problems involving the neck and shoulder. So pag pinapalpate po natin yan, mararamdaman natin yung mga bukol-bukol. For musculoskeletal problem in the neck, shoulders, and scapula, the area from small intestine 3 to small intestine 4 most often will present with small nodules. Makakapapunin nyo yan. May mga parang maliliit na bukol-bukol. And will also feel slightly tight. The area is generally tight without nodules. In acute exterior condition that involve blockades in the Taiyang channel. So kung may blockades po doon, makakaramdam kayo ng parang matigas kahit wala po siyang nodules. So ibig sabihin nun may blockage yung channel. Finally, this area may actually feel soft and weak where there is chronic yang deficiency type immunity problems. Kung kinapa naman daw po ninyo na medyo naramdaman yung malambot siya, tapos yung pulse, na may pulso po kasi doon weak yung pagpintig ng pulso doon sa part na yon. So chronic yang deficiency po yan. So immunity problems. Halimbawa po, madali siyang magkaroon ng sipon, easily catching cold. So ganun po yung mapapalpate dyan sa area na yan. Makakapanin yung mahina. So ayan po yung small intestine 4 sa likod ng ano. So pag may nodules, okay po, ayan nakita natin Pag may nodules naman po or may pain or tenderness sa area ng small intestine to small intestine 6, small intestine 4 to 6, often indicates presence po yan ng fire pathogen. Ibig sabihin, pag matigas po ay heat kasi fire. So, inflammation in the upper aspect of Taiyang channel, pwede raw po may inflammation. So, this area should be examined very carefully in any patient who present with neck problem. So, yun, kapain nyo yung area na yan. So, the area begins distal to small intestine 4, sa may palad and then continues to the area proximal to styloid process of the radius. So, sa taas po yan ng spleen 6, ay small intestine 6. In the most distal section, the tendency to headache along the bladder channel or apex of the do vessel, around po yan sa gallbladder 21, is most prominent. Then moving proximally, cervical, neck issue are also most likely to manifest. Eye problems are often reflected in palpable changes in this area. So po yun, pag nakapapo natin doon, involve yung neck, yung cervix, and the eye. In general, tenderness or generalized increase in muscle tone, yung pag pinalpate po ninyo, parang matigas, over the entire area is associated with muscle and tendon injuries. So while nodules are more likely to indicate changes in the cervical vertebra, pag may mga nodule, yung cervical vertebra mismo po ang may problema, disease. Finally, because small intestine 6 is the cleft point of the channel, there may be a thin nodules cutting across the channel here in acute low back spasm. So, bumabara po yun kung may mga nodules kayong nararamdaman. May bara. Okay. So, Taiyang channels yung affected. So, ayun po doon yung lang kakapay sa may kamay. Yan, sa may buto ng ating wrist. Yun ang small intestine 6. So, the small intestine channel on the face and in front of the ears is often affected in cases of facial pain. Yung may Bell's palsy or may trigeminal neuralgia. So, carefully ipalpate po natin to para matidetermine natin ang affected area for treatment. So, in acute cases po, any of this condition, it is best not to needle the face at all. Wag daw pong ini-needle. Only distal point po, pag may mga ganong condition na may affected yung face, distal point po ang gamitin. Only after the initial inflammation have subsided. Kung may mga pamamaga, hindi nyo pwede pong tusukan yung area na yon. So, distal point po ang gagamitin. Alisin muna ninyo yung pamamaga, 5 to 7 days. It is considered safe to lightly needle around the affected areas. So, parang nagaano po kayo sa ASI point, sa around nung affected. In general, the small interweaving channels of the face are regarded as collaterals. Therefore, collaterals or loop points on all the channels passing through the area should be considered for the treatment. So, pwede po tayong magtusok doon, hindi doon direct sa mga points na affected na may inflammation. Pwede po natin gamitin yung connecting channels or loop points. Yan. Tingnan natin nasaan nakakonect. So, in this case, pwede po yung small intestine 7. So, in both acute and chronic cases. Yan po, ano. So, nakita po natin yung mga points. Pag may nodules po, type, musculoskeletal pain po yung problem. Affecting neck and shoulder. So, scapula. Parang summary po tayo. So, pag may hardening po, acute condition, affecting tayang. Pag may softness or weakness, chronic yang deficiency po yun. So, pag weakness, basta tandaan natin, lagi may deficient condition yan. Lead to immunity problem. Then, sa nodules naman po, pag nag-ano kayo sa small intestine 4 and small intestine 6, nodules, chronic, neck issue, chi stagnation, and pain. So, yung pag nakakapa kayo ng parang bukol-bukol dyan. Then, pag matigas po, so neck issue po yan. So, more chronic po siya at na-involve po dyan ang cervical vertebra. So, pagkapa nyo at matigas, cervical vertebra may disease. Pag may pain naman or may inflammation in tendon, muscles of the neck or eye. So, pag may pain po siya, may inflammation po yun yung mga tendon. So, sa neck or sa eyes. Pag stiff like nodules, acute po yan. Acute inflammation in neck after tayang. So, yan po yung mga summary. Thank you po.
Thank you very much, Ma'am Mildred. We now come to the last topic for today. We are starting a new topic. It's a chest painful obstruction syndrome. This condition goes under the name of chest painful obstruction or chest P, characterized by a feeling of oppression and pain in the chest, extending to the shoulders. In severe cases, the pain is greater than the sensation of oppression. In very severe cases, there is stabbing pain in the heart region on the left side of the chest, extending to the left shoulder and down the left arm. The P in chest P is composed by the radical for disease and a character indicating obstruction. The fact that the word P here is the same as that in P syndrome, ache in the joints from invasion of wind, cold, and dampness, should not induce us to make any correlations between these two very different conditions. In P syndrome, only the channels and joints are affected. In chest P, the internal organs are also affected. Chest P may correspond to very different types of disease than P syndrome, such as coronary heart disease, angina pectoris, chronic bronchitis, pulmonary emphysema, or cancer of the lungs. The obstruction in chest painful obstruction syndrome is obstruction in the circulation of qi and blood in the chest by qi stagnation, blood stasis, phlegm, or cold. Chest painful obstruction is mentioned in the Yellow Emperor's Classic of Internal Medicine. The simple questions in chapter 22 says, when the heart is diseased, there is pain in the center of the chest. Hypochondrial fullness and pain involving the chest, back, and scapulae, as well as both arms. The spiritual axis in chapter 24 says, in true heart pain, the arms and legs are cyanotic and cold up to the elbows and knees, and there is severe pain in the heart region. This corresponds to a severe type of chest painful obstruction, and during the Han Dynasty, Zhang Zhongqing, in the Essential Prescriptions of the Golden Cabinet, introduced the term chest painful obstruction, or Chong-P, for the first time. In chapter 9, he says, in chest painful obstruction, there is breathlessness, cough, pain in the chest and back. The front position pulse is deep and slow, and in the middle position, tight and rapid. And so you have to use a Trichosanthus allium white wine decoction. Slow and rapid do not refer to the actual rate of the pulse, which could not be slow in one position and rapid in another, but to the feeling of the pulse. In the same chapter, he says, in chest painful obstruction, when the patient cannot lie down and the heart pain extends to the back, use the Trichosanthus allium pinellia decoction. Qing Jichen's causes of disease and treatment according to the pulse says, pain over the sternum indicates chest painful obstruction. The internal causes of chest painful obstruction are the 7 emotions and the 6 excessive desires. They stir heart fire and affect the lungs. They may also cause rebellious qi to damage the lung passages and phlegm to accumulate and qi to stagnate. Chest painful obstruction may also be caused by excessive consumption of hot pungent foods, which injure the upper burner and cause blood to stagnate. This leads to a feeling of oppression and pain of the chest. Traditionally, there are 3 types of chest painful obstruction. Shin Tong, or heart pain, pain in the chest. Chen Shin Tong, true heart pain, pain in the chest with cyanosis of face, arms, and feet. Chue Shin Tong, breakdown or heart pain, pain in the chest with cold limbs. From a Western medical perspective, chest painful obstruction may correspond to several different diseases pertaining to the heart or the lungs. If there is pain in the left side of the chest, palpitations and shortness of breath, it may correspond to angina pectoris, myocardial infarction, or coronary heart disease. If there is cough, breathlessness, and expectoration of phlegm, it may correspond to chronic bronchitis, chronic tracheitis, pulmonary emphysema, or cancer of the lungs. Examples of patterns corresponding to lung diseases may be turbid phlegm stagnating in the chest or spleen and heart yang deficiency. In some cases, chest painful obstruction may correspond to chronic gastritis. Thank you, everyone, for your attendance, for your attention, and we hope to see you in our next videos. Thank you very much.